It is a pleasure for me, as Director of Regional Health Services, to give the welcoming remarks to this, our second Regional Health Officers meeting for the year 2016. And I'd like to start with this quote from Isaac Newton, in which he said, "If I have seen any further, it's by standing on the shoulders of giants."
It probably in some way helps to bring to the fore this whole issue of how we manage health in Guyana, and maybe whether it would ever be possible to bring all the key actors together to discuss the business of health. Dr. Shako, many RHOs before you have tried and to get REOs and regional officials together to meet with health to discuss the delivery of health care. It is, as one songwriter puts it, still an elusive dream. Indeed, RHOs, you are quite an important group, and we certainly recognize the hard work you've been doing. I believe that if one attempts to single out a particular group that will make the biggest impact on health services, it will have to be the RHOs. Because at the end of the day, what happens in regional and clinical services, what happens in the regions where health is actually delivered, where it's rolled out, that will determine what impact we make on health in Guyana, and indeed what returns we get for the investment we make in the health sector. RHOs, you have serious challenges. Time will not permit me to share with you those that I find quite relevant and quite important. All of those, rather, I'll just share a few this morning. The first challenge I want to raise is the challenge to know your region. It is still true that one size wouldn't fit all, and in the delivery of health care, each region brings with it its own logistics, demographics, topographic uniqueness and peculiarities. Each region brings with it its own challenges, its own dynamics. And may even have different public health and epidemiological challenges. It therefore means that if we are going to deliver health services, we have got to be acquainted with the uniqueness and the peculiarities of our regions. Because at the end of the day, whatever programs we develop, whatever budget we submit, it must be aimed at achieving, or rather targeting, those peculiarities that are in your region. In other words, as I've said to some RHOs, identify what are the things that make your region unique and what are the things that need to be changed. And how are we going to change those things? What are the resources that are required to change those things? And how I can make the best use of the limited resources available. Sometimes we can get stuck at identifying what are the resources we need to achieve our objectives. And get stuck there because one can argue, and I guess not unreasonably so, that I do not get all the resources I need or all the resources I desire or I want, and as such I could not achieve my objective. And maybe that may not be an invalid reason. But management goes beyond making excuses for what one does not have. Rather, the proactive manager will say, well, this is what I have, and I'm going to make the best use of this. I'm going to make sure that the resources I have, I make optimum use of those resources. So the challenge is to identify those things that make your region unique. Identify what are the challenges, what are the issues that you need to address so that you can make an impact. In other words, 2017 must be different from 2016 based on achievements. For health, it's not just, as one PS used to say, just be business as usual. It's not enough to say that we have a budget and we just go through the motion, as it were, year after year. It must be that there are things that are going to happen in my region in 2017 that will make an impact on healthcare. And that brings me to the next point. Currently, the Ministry of Health, to a large extent, has responsibility for data collection. I raise this matter with the Permanent Secretary of the Ministry of Communities because I believe that going forward into 2017, it is not enough. As a matter of fact, it has never been enough for the Ministry of Public Health to be sending officers, sending stats clerk and other personnel to the region to gather data. I believe that we have got to sit down, and one of the things I'll be doing with the Ministry of Communities this year is to revise the organizational structure for regional health departments. As a matter of fact, we have already agreed that myself, PS McGarrell from Communities, PS Welch from Indigenous Affairs Ministry, and PS Ned from Education. We have established a small group and we will be meeting every month to look at issues that cut across our various sectors.
About 2 weekends ago, I was doing some reading, and I was reading about Pythagoras. How many of us have done some math or have heard of Pythagoras? Okay, looks like quite a fair number. All right. And I was reading about mental health. And they were saying that, in fact, suicide to be precise. And I read that Pythagoras actually did not support suicide, even though in the Roman times, if you wanted to commit suicide, you had to go and meet a committee of elders. And you give all your reasons. And if your reasons meet what they deem as important, then they give you a pass, and they actually give you the medication. And the medication was called hemlock, and I'm sure most of you have read about hemlock. I'm telling you this story about Pythagoras because Pythagoras was against suicide. And I wanted to know why he was against suicide. And I thought he was against suicide because of moral reasons. And it turned out that he was against suicide not because of moral reasons, but he was against suicide because he said there was a finite number of souls to be on the earth at any one time. And if you commit suicide, you disturb the equilibrium. So I was thinking about it when I entered this place and I saw the place half empty. I said Pythagoras should have been here. He would have known that our RHs have disturbed the equilibrium to have the room half full. I just also want to raise a small issue about the RHs, and I think it came up earlier on by the RHS director, that we do have a regional health authority system. I think so far we do not. And my my impression is that it's probably going to either take a very long time to take place or may not take place. I think I will go with what the PS is saying, that in the interim, we are sailing on a boat that is not fully functional. We still have to sail it. So I think I'll go with what PS is saying. Let us be in direct communication with the Ministry of Communities, Indigenous Affairs, and other allied ministries, and make sure that they do what we want, so that if we cannot get the RHA system operational, because that's by an act of parliament, if we cannot get it operational because of issues of the Local Government Act, then at least we can get something as close to it as possible. In Guyana, we met 2 out of the 8. However, I'm not saying that because we met only 2 out of the 8. The review that was done by UNDP, that's what I'm quoting, we met 2 out of the 8. Does not mean that we didn't do well. We did quite well in many of the others. However, we still didn't meet the target that was set. Now, having said that, the new SDGs, all of you, I'm sure you are aware, has 17 goals. Now, out of the 17 goals, health is represented in all the SDGs. You name it, and I'll tell you how we are linked to the SDG. But just for argument's sake, I just want to take SDG goal number 3, which is the one that deals with health. Now, that has 14 indicators. Now, the same one goal has 35 complementary national indicators. Now, I'm going to sit through some of the presentations here, and I'll take my indicator lessons and try to see how many of your reports actually touch on any of the indicators. And at the end of your presentations, I'll tell you my marks. Ladies and gentlemen, I'm saying this because there must be accountability in our work. PS dealt a lot about the administrative issues and the management issues. And I just want to spend a little bit of time, if I may, probably 5 minutes, on just some of the technical areas. Like I said, if there are 14 indicators in SDG 3 alone, with 35 complementary national indicators, then there must be accountability in our work. There must be stakeholder involvement, which I think, by and large, you do have. UNICEF, PAHO WHO, UNFPA, and sometimes, give or take, UNDP. We must also examine the role of this meeting. It is to evaluate our work. And if it is to evaluate our work, then we must be able to tell this meeting that last year when I was here, these were the indicators that I met. 1 more year, this is what I've done. The ones that I didn't meet, these are the plans that I've put in place to meet those ones. If you cannot do that, then we don't have to have this meeting. We need an accountability framework, ladies and gentlemen. We also need a performance framework. If persons don't perform, get rid of them. There's also a need for an improved collection and collation of data. PS did mention it. And I'll just say a little bit about strategic information. And I'm glad Honorable Minister was with us when I went to Jamaica with Honorable Minister in Belize. And I keep saying, at the time we were there, they had their 2015 national health data out, published. And some of them had the first quarter, and some of them had even the second quarter of their national health data published. Now, we in Guyana, we have 2013 published. Ladies and gentlemen, if the data rests with you in the field, bring the data to the central level. That is the only way that we can make decisions with the evidence. I was just speaking with CMO about the data, and he also has his own frustrations as to why the data is not moving. We need to do better. I'll give you an example. I think it was Jamaica. either Jamaica or Belize, and Minister and Dr. Shiko were there. One of the regional directors said, I was looking at my data and I was transferring a lot of persons from my region to the central level, to the referral hospital. And I realized that I was doing most of the referrals. So the ambulance costs were going up and up and up. So I decided to do a little review. I looked at my data and saw what the referrals were for. And the referrals happened to be obstetric in nature. So I went to the national level. I said, give me an obstetrician. The moment they gave her an obstetrician, that was the end of those massive number of referrals. That is evidence-based practice. PAHO WHO is glad to provide technical cooperation on most, if not all, the components of health that Ministry of Public Health deals in. And I must say that we still look forward to our continued collaboration. Ladies and gentlemen, I would want us to do better. And if it means coming up with something to motivate the RHOs and say that we are going to be measuring everybody by, say, 30 indicators every year, core data, and the region that does best will be given a scholarship, or the RHO will be given a scholarship, or the region that does best will be given a prize. PAHO is prepared to do that. Now the ball is in your court.
PS, Permanent Secretary, would have more or less done a SWOT analysis, looked at the strengths, the weaknesses, our opportunities and challenges or threats to the Ministry of Public Health. He would have spoken about doing district analysis as we go into the regions and we decentralize the delivery of health care, look at some of the needs that we need to come up with, especially for the district hospitals and for the regional services. You would have been here, I would have known what it should look like, and so we're able to go have our list, our needs list, so that we can work towards that. With a deep sense of appreciation, ladies and gentlemen, that I stand here today to share remarks with you on the opening of this very important meeting. Whereas at the central level, we looked at governance and policy and maybe quality improvement, the Ministry of Public Health, through its Regional Health Services Department, is primarily tasked to service delivery in the 10 administrative regions. They are tasked to deliver the best possible public health care of the highest quality to every person living in Guyana. And so I'm delighted to see that this meeting has a theme that reads, collaboratively, we build a resilient health system that is acceptable, accessible, timely, and appropriate to meet the needs of every person in Guyana. Hence, that's your caption. The delivery of public health care and public health care services is undeniably a collaborative one. And at this time I can put an injunction to say I wish that the Ministry of Communities, the Minister of Health, or the Minister within should have been here. Hence, we have the Ministry of Communities being so robustly not represented here, I should say. The Ministry of Communities and Public Health must work collaboratively to ensure that public health care services are delivered to every Guyanese in the most competent and proficient way possible. Ministry of Public Health can't do it alone. We cannot. There must be parity in the delivery of public health care services across all regions of Guyana. I think the Director of Regional Services would have alluded to that as we try to narrow the gaps of inequities and inequalities between the hinterland and the coastland. Improving the public health care system in Guyana is one of the APNU AFC placed as national priorities of the Ministry of Public Health. This priority focuses on strategic approaches to improving the safety, effectiveness, patient-centeredness, timing, efficiency, equitability, and accessibility of best quality care and healthcare practices and facilities across Guyana. We do recognize that the regional health services is the nerve center of the Ministry of Public Health. It is through this department that public health care is delivered in every region, as I reiterate. Therefore, it is imperative that each officer in the department, in the respective regions, recognizes that he or she has a vital and a major responsibility to provide optimum service to each person in the region who requires health care, regardless of religion or ethnicity. So we must build better relationships with the regions. If I'm going to rate our relationship with the regions from 1 to 5, maybe you can help me to give the score. I think it's below 4. Essential to the delivery of best quality health care in the various regions is the ability to work in line with the various regional health authorities. So the regional health authorities, there's also an act for that, and we had a pilot, as was told to us in Region 5 and 6, and we have gone through the gaps and did a costing and all of that. While there may be a shift in the different focus areas, regional health services, through its various regional health officers, must build bridges and establish mutually beneficial relationships in order to be able to advance the work of the ministry, while simultaneously providing these essential and sensitive essential packages of services. It's imperative for us to recognize that there's an urgent need to increase the capacity of public institutions' involvement in regional development and strengthen the cooperation between national, regional, and local authorities in Guyana. Based on this premise, it is crucial that we ensure that there is a targeted distribution of available resources. Bilateral relations must be strengthened through cooperation on development and implementation of public health care initiatives. Building institutional relationships between the Ministry of Public Health and the various regional administrations can foster mutual understanding of public sector areas involved and lay the groundwork for building institutional relations and creating networks from which we will all benefit in the longer term. So it is an obvious necessity for the regional administration to work collaboratively with the Ministry of Public Health to fix the many issues affecting the regions in the area of public health. And so I can digress to say, okay, last year, we don't want to go too much backwards, even though it will inform what's happening in the present and the future, but we had monies going back to the Consolidated Fund. Could someone not have had a meeting and say, okay, here we are, the hour is late, but what can we do to see how we can address this issue? There was no intermediate or medium term, short term that we could have done something rather than taking back all the money back to the Consolidated Fund. You know, that's what we're talking about, collaboration. Okay, Ministry of Health, rather than blaming the Ministry of Public Health or blaming communities, could some sensible person have said, okay, let's come together. This is the problem. Let's see how we can solve it. And what's the way forward in the interim? May I remind you that you are the administrators of one of the most important sectors in the country, the health sector, and we have been working with the Budget Secretary at the Ministry of Finance to ensure that we try to reach the target set by the panel, our international partners like PAHO, that health takes up 6% of the GDP of our country, Guyana. Individually and collectively, you administrators touch the lives of every citizen of this nation, directly or indirectly. You make a significant difference to the people's way of life, one way or another, in the decisions you take. As we spoke about earlier, the profile of your area, of your district. Where I worked the last time before I turned minister, I was at industry. And so we realized that people are going to work. So we had extended hours. We work up to 8, Tuesdays, I think, and Saturdays, up to 8, because we want to capture those who can't come to clinic in the mornings. Do you think of doing that in your community, in your area? Okay, people are going to work. We want to catch them at this time. I think it's done in Anai, where we went to last week. You know, why is there a difference between Pleasance Health Center, which is run by the region, and Industrial Health Center, which is run by Georgian Public Hospital. Why should there be a difference? And it's just about a mile or two away. Think about those things. Moreover, I would like to encourage all of you to work more efficiently and effectively as you collaborate and consult with each other. And I will be working with the Pan American Health Organization to work on telemedicines. We know that we have some young doctors going to the interior. Of course, you've done your rotation and there's a need, and we've trained over 300, maybe 600 doctors came from Cuba. We have to put you somewhere. So whereas we had like maybe just a medics or a chief CHWs and so on, we want to improve the quality care, so we're putting some doctors there. We must develop strategies to help us to synergize our collective efforts in order to raise the level and quality of public health care we deliver in every region. This ministry operates in the service to the people of Guyana. I urge that each of you rally your charges, and together let us do our utmost to deliver the best quality public health care as we possibly can. We must all work assiduously to preserve the image of this ministry while serving the needs of the Guyanese people. And I don't want to give you a warning, but under my tenure and under the Senior Ministers of Health, Dr. Norton Stendhal, we definitely going to make sure that our legacy in this 5 years will be second to none. And we're working together as a team, will be helping us to achieve that. Because we don't want to beat up on ourselves, okay, you'll see where the shortcomings are. But we identify them, and we want to rise above that. This is the problem. We're all Guyanese. And we're going to work together as a team to ensure that we raise the bar and that this healthcare delivery in Guyana will be second to none. It is only through efficient and effective service that the quality of healthcare will be improved. I want to encourage you today to make these two words, efficient and effective, your watchwords for service. With these two values permeating your every action, each region, and of course Guyana, will have an enviable healthcare system. Through our deliberations over the next few days, let us focus on significantly improving, on all counts, the quality of the work we do. Explore more efficient and effective ways of information sharing. Let us communicate more successfully with each other. If it comes that I have, in some cases, I went to Anai. I can't remember one of the places I went to was last week with MCH and the Gavi team from Geneva, that if we have to ask Mr. Craig to give us a frequency just for health, because some of the frequencies with the radio system we are sharing with other regions and other sectors, I will have to do so. If I have to get a frequency set just for health, I will be able to work towards that. Let us communicate more successfully with each other. Let us align our collective vision with that of the Ministry of Public Health. Let the decisions be made at this forum focus on improving delivery of accessible, high-quality, professional, and equitable health care. Let us work efficiently and effectively, our watchword, to make universal access to health care in Guyana a reality.